Hello everyone, I am Dr. Omkar Sangita Dilipra from team FMGE, and today we are back with a very important and a high yield topic from the subject of biochemistry, and it also has its related aspect to the nutrition topic from PSM. So therefore it becomes very much important, and once again it has been proved that vitamins are one of the most important topic, because in December 2021 FMGE session there were almost 3 questions from vitamin B12 itself. So definitely people tend to skip biochemistry, but I would like to request them to at least cover biochemistry in the important topics as well. Okay, please remember you need to cover at least vitamins, and please remember to cover the rate limiting enzymes and the important metabolic pathways. Along with that, don't ever forget to cover inborn errors of metabolism, right? Because it is also an overlap topic from pediatrics. So with this, we will begin our topic for today, that is vitamins overall. So we will not only discuss about vitamin deficiencies, rather we will also discuss in and around the vitamins as well. So first of all, talking about vitamins, what are vitamins actually? So please remember, vitamins are organic compounds. These are found in all the food substances in minute quantities, and they are responsible for the growth and development of the body. Right, they are responsible for growth, development and maintenance of the body. Right, now usually vitamins are considered as dietary essentials. What do we mean by dietary essentials? That means they are not synthesized in our body and they are to be taken in our diet. So please remember, therefore they are considered as dietary essentials. But there are some vitamins in the body which are synthesized inside our body. Okay, and these are called as endogenously synthesized vitamins. So the most important 2 vitamins which are synthesized by our own body are, first is vitamin B3, which is also called as niacin. So vitamin B3 or niacin is synthesized from an amino acid called as tryptophan, whereas the other one is vitamin D, and as we are quite aware that vitamin D is synthesized in our own body when it is exposed to sunlight, right? So it is developed from its precursor, that is 7-dehydroxycholesterol. Then if I move further to other vitamins which can also be synthesized inside our body, but they are not synthesized by our own body, rather they are synthesized by the intestinal bacterial flora. So the bacterial flora in our intestine will synthesize these vitamins. The first one being the most important, that is vitamin K, can be synthesized in our gut. Then the next one is vitamin B5, also called as pantothenic acid, can be synthesized in our gut. And the third most important is vitamin B7 or biotin, can also be synthesized. So please remember, the 5 endogenously synthesized vitamins in human body would be vitamin B3, vitamin D, vitamin K, vitamin B5 and vitamin B7. Okay. Then if I move further, talking about the major classification of vitamins, as all of us are quite aware from our school years that vitamins are generally classified as fat or lipid soluble vitamins, whereas the other group being water soluble vitamins. So please remember, the fat soluble vitamins are vitamin A, D, E, K, that is vitamin A, vitamin D, vitamin E and vitamin K are all fat or lipid soluble vitamins. On the other hand, vitamin B complex, I'll talk about all the vitamin B. Okay, so vitamin B complex and vitamin C are considered as water soluble vitamins, right? So I will talk about the major differences between these two. So the fat soluble vitamins, that is ADEK, they will require chylomicron for its transport, whereas water soluble vitamins would not require chylomicrons for its transport, right? First thing. Secondly, fat soluble vitamins can be stored inside our body, and the major storage sites for fat soluble vitamins would be the liver and the adipose tissue. So please remember, the fat soluble vitamins can be stored inside our body in the liver and adipose tissue, whereas the water soluble vitamins cannot be stored inside our body. Please remember. Okay, they are directly excreted out in the urine. Then if I talk about toxicity, so please remember, the vitamins which can be stored inside our body would generally be toxic, whereas the vitamins which can be directly excreted out from the body, that is water soluble, these vitamins would not be toxic. So generally water soluble vitamins are not toxic except for vitamin B3, that is niacin, and vitamin B6, that is pyridoxine. So niacin and pyridoxine definitely have shown some toxic effects as well in human body. Then if I talk about the functions, so please remember fat soluble vitamins have a variety of functions, whereas water soluble vitamins majorly they play only a coenzyme role, right? They will help multiple enzymes inside our body. Then now if I move further to talking about one by one vitamin, so the first vitamin in line is vitamin A. As we discussed, it is a fat soluble vitamin. So please remember vitamin A structure is made up of retinoids, as well as it is also composed of carotenoids. So retinoids is obtained from animal sources, whereas carotenoids is obtained from plant sources. And as we know, the most important carotenoid is beta carotene, and the richest source for beta carotene is actually carrots. Okay, it is usually carrots, right? Then if I talk about retinoids now, so retinoids can be in different forms. The first form would be the alcohol form, that is retinol, right? And retinol is responsible for reproduction inside the body. The second is the aldehyde form, which is called as retinol, and as we all know, the 11-cis retinol is converted to rhodopsin and then to meta-rhodopsin 2, which is usually in the Waltz-Vigil cycle, and it is responsible for vision. And the third is the carboxylic acid form of retinoids, which is also known as retinoic acid, which has three important functions. The first most important being regulation of gene expression. So please remember, it is responsible for regulation of gene expression. The second important function is tissue differentiation. Okay, second important is tissue differentiation, and third, it is responsible for the growth and development of a body, right? So these are the major functions of vitamin A that I have spoken about. Then if I talk about the storage of vitamin A, as it is fat soluble, it can be stored inside our body. So please remember, once vitamin A is absorbed from the intestinal lumen into the intestinal cells, it is usually transported to the liver, okay, and it is transported in the form of retinyl esters. So please remember, usually vitamin A is stored in the form of retinyl esters, and this transport from the intestinal cells to the liver, it is carried out by chylomicrons, right, as I've said already. So vitamin A is stored in the form of retinyl esters, and it is usually stored at which site? So it is stored in the liver, but at which site in the liver? So please remember, this is important, it is the perisinusoidal cells, okay. So the perisinusoidal, also called as the stellate or the ito cells of liver. So in these cells, vitamin A is generally stored in the retinyl esters form, perisinusoidal, stellate or ito cells. This is an important one-liner. Then if I move to the transport of vitamin A, so please remember, from liver, then it would be transported to the target organs like the skin or the eyes whenever required, and it would be transported in a form of a ternary or a trimolecular complex. And this ternary or a trimolecular complex of transport of vitamin A would generally contain, first of all, retinyl esters, that is vitamin A, then the retinol binding protein, and the third component would be transthyretin. So this trimolecular or ternary complex would be transported to the target organs, therefore, right? Then if I talk about the most important PSM aspect of vitamin A, and that is National Immunization Schedule. So according to the National Immunization Schedule of India, usually we found out that, please remember, the most common cause of preventable blindness is vitamin A deficiency. So please remember, the most common, this is an important one-liner, the most common cause of preventable blindness is usually vitamin A deficiency, or we can say the most common cause of blindness in childhood is also vitamin A deficiency, right? And that is why usually vitamin A solution, okay, please remember, vitamin A solution has been started in our national immunization schedule to our children below 5 years of age. The first dose of vitamin A is generally given at 9 months of age, and the dose is 1 lakh international unit, whereas after 1 year, that is after infancy, that is from 1 year to 5 years of age, we give vitamin A solution every 6 months. That means twice a year, okay, every 6 months it is given, that means twice a year, and the dose here would be 2 lakh international units. These doses have been asked, please remember this. at 9 months, the first dose would be 1 lakh international units. Thereafter, from 1 year to 5 years, every 6 months, 2 lakh international units. So the total doses given, 8 plus 1 would be 9 doses, and the total dosage would be 17 lakh international units. All of this is important, please remember, right? Then now, if I talk about vitamin A deficiency, so as we know, please remember, the most common vitamin deficiency is usually vitamin A deficiency, and that can lead to blindness further, right? But please remember, vitamin A deficiency usually starts or manifests first of all with dryness of eyes, okay? But the patient could not complain of dryness of eyes, so that could not be a symptom, okay? So the earliest symptom that the patient would complain of is called as nyctalopia. That symptom is nyctalopia, also known as night blindness. So if they ask you the first or the earliest symptom of vitamin A deficiency, the answer should be nyctalopia or night blindness. Whereas the earliest sign of vitamin A deficiency would be, in vitamin A deficiency there is dryness of eyes, as I told you. So there would be conjunctival as well as corneal dryness, right? So this condition is known as xerophthalmia. So the first or the earliest sign of xerophthalmia would be conjunctival xerosis, dryness of the conjunctiva. The first or the earliest symptom would be conjunctival xerosis. All of these are important, as well as there would be loss of vision to the green light. Okay, if they ask you earliest vision loss is seen to which color, then it is the green color. Loss of vision earliest, it is seen to the green light. Then now if they ask you which is the most pathognomic feature of xerophthalmia, then the most pathognomic feature of xerophthalmia are the Bitot spots. Okay, these are the toothpaste like fluffy exudative spots which are seen on the sclera, as you can see in this image. So these are known as the Bitot spots, X1b classification of xerophthalmia, and these are considered as the most pathognomic clinical manifestation of vitamin A deficiency, right? Whereas there would be some skin manifestations also, because please remember, vitamin A is also responsible for the maintenance of epithelium of skin. So if there is vitamin A deficiency, there would be follicular dermatosis which is seen. Okay, this follicular dermatosis is also called as papilla dermatosis, and it resembles a toad like skin. As you can see in this image, there would be a toad or a frog like skin, and this condition is also called as phrynoderma. So phrynoderma or follicular dermatosis or a toad like skin are feature of vitamin A deficiency. These are important things to be remembered, right? If I move further now, talking about toxicity of vitamin A. So if there is toxicity of vitamin A, that leads to a condition called as, which has been asked in the question, and this is pseudotumor cerebri. Okay, that leads to a condition called as pseudotumor cerebri, where the patient would generally complain of nausea, vomiting, dizziness, there would be headache, okay, and most important, there would be blurring of vision as well. This condition is due to vitamin A toxicity and known as pseudotumor cerebri, as well as there can be exfoliative dermatitis as well. Okay, exfoliative dermatitis can also be seen in vitamin A toxicity. If I talk about the therapeutic applications or the therapeutic uses of vitamin A, so please remember, first of all, we know vitamin A contains beta carotene. So beta carotene is usually used in cases of cutaneous photosensitivity, right? Whereas the other therapeutic application can be tretinoin. So please remember, tretinoin, which is also called as all trans retinoic acid. So tretinoin or all trans retinoic acid, this has actually major applications that you need to remember. So please remember, it can be used in cases of mild acne as well. Okay, it can be used in cases of mild acne, but the most important application of ATRA is in M3 variety of AML. As we know, M3 variety of acute myeloid leukemia, it is also called as acute promyelocytic leukemia. In this condition, M3 AML, the drug of choice would be ATRA. The drug of choice in M3 AML is ATRA. Please remember this. This is most important. As well as one more retinoid analog, that is isotretinoin, that is 13-cis retinoic acid or isotretinoin. It is usually used in cases of grade 4 acne, that is nodulocystic acne, the most severe form of acne. Here we use isotretinoin. Also it can be used in cases of neuroblastoma, right? But please remember, this is important, that isotretinoin is actually a teratogenic agent, so therefore it should be avoided in pregnant females. So isotretinoin is a teratogenic agent, right? Then if I move further, talking about the sources of vitamin A. Vitamin A definitely can be found in liver, in fish, in meat, along with that in dairy products like milk, cheese, butter, all of that. But if they ask you the richest source of vitamin A, this has been asked earlier as well, the answer should be halibut fish liver oil. Your answer should be halibut fish liver oil. This is the richest source of vitamin A. Then if they ask you the richest plant source, as I told you, beta carotene is in highest quantities in carrots, therefore the richest plant source of vitamin A also is carrots. Important, okay, please remember this. Then please remember, definitely they can ask you even about iron as well. So please remember, usually for iron it is usually the dried pumpkin seeds which are one of the richest sources that you need to remember. Then if I talk about the recommended dietary allowance now, okay, the recommended dietary allowance for children of vitamin A, it is usually 400 micrograms per day. It is 400 micrograms per day. That for adults usually would be 600 micrograms per day, and which increases to 800 micrograms per day in pregnancy. Okay. Then if I move further, talking about the next fat soluble vitamin, that is vitamin D. So vitamin D is actually synthesized from cholesterol. So as we know, the precursor of vitamin D is 7-dehydroxycholesterol. So it is actually a group of sterol molecules, and please remember, vitamin which has a hormone like action is vitamin D. So the vitamin which has a hormone like action is vitamin D, that you need to remember. Now if I talk about the active form of vitamin D, I hope all of us are quite aware that it is 125 dihydroxycholecalciferol. 125 dihydroxycholecalciferol, also known as calcitriol or vitamin D3, is the most active or the most potent form of vitamin D. Okay. Then if I talk about the synthesis of vitamin D, as we know, vitamin D can be synthesized in our body as well. Therefore, we need to look for the synthesis mechanism. First of all, whenever there is exposure to ultraviolet B rays, that is whenever there is exposure to sunlight in skin, what happens usually is the 7-dehydroxycholesterol, which is the precursor, it would be converted to cholecalciferol. Then this cholecalciferol would transport to the liver. In liver, what will happen? This cholecalciferol would be converted to 25 hydroxycholecalciferol. Okay, so a hydroxyl group is added at the 25th position. So 25 hydroxycholecalciferol, and this is mediated by an enzyme known as 25 hydroxylase. Whereas after 25 hydroxycholecalciferol is formed, it is transported to the kidneys, which is the last resort. So in kidneys, it would be converted to its most active form, that is 125 dihydroxycholecalciferol, also called as calcitriol or vitamin D3, by the enzyme known as 1-alpha hydroxylase. So this 1-alpha hydroxylase, please remember, it is the rate limiting enzyme of vitamin D synthesis. So if they ask you which is the rate limiting enzyme of vitamin D synthesis, the answer should be 1-alpha hydroxylase. And where it is located? So please remember, it is located inside the kidney. So these are the common questions they usually ask. Okay, please remember this. Then if I talk about the functions of vitamin D, usually vitamin D has major functions. First and the most important function is actually regulation of calcium and phosphate levels. Okay, regulation of calcium and phosphate levels. As we know, vitamin D is known to increase the serum calcium and serum phosphate levels, as it mainly acts at two places. In intestine, it will increase the calcium and phosphate absorption, whereas in the kidneys it will increase the calcium and phosphate reabsorption from the tubules, right? So please remember, these are the two places where vitamin D mainly acts, and it increases the serum calcium and phosphate levels. Whereas it is also known to cause bone development. As we know, vitamin D also has an action on bones. So in bone, usually it increases the osteoblastic activity, and most importantly, it also increases the bone mineralization. It increases the deposition of calcium and phosphate crystals in the bone. Therefore, the bone mineral density usually increases with vitamin D. Apart from that, it also has an immunomodulatory function. What do we mean by immunomodulatory function? So please remember, vitamin D is known to produce a protein known as capsaicin, which in turn destroys Mycobacterium tuberculosis. Therefore, it has an immunomodulatory function, as well as it is also has an anti-proliferative role. That means in cases of vitamin D deficiency, it is implicated that there are higher chances of colorectal, breast and prostate cancer. Therefore, it also has a anti-proliferative function. Then if I talk about deficiency of vitamin D, all of us are quite aware, deficiency of vitamin D, if it occurs before skeletal maturity, that is in children, it will cause rickets, whereas when it occurs in adults, that is after skeletal maturity, it would lead to a condition known as osteomalacia, right? We have already discussed in details about rickets and osteomalacia in our orthopedics test and discussion in class. So I will just like to enumerate some important points about rickets. So first of all, in rickets there would be decreased vitamin D levels that will cause decreased mineralization of the bone, right? There would be delayed closure of the fontanelles, there would be widened suture lines, there would also be soft skull, which is also called as craniotapes, there would be frontal bossing, there would be beading of the costochondral junctions, and that would lead to a non-tender and a rounded rachitic rosary. There would be delayed dentition in these children. Along with that, there would be Harrison's sulcus or a Harrison's groove, which can be seen beneath the rib cage. Then there can be some chest deformities like pectus carinatum or pectus excavatum, and there would be some deformities in the extremities as well. That can be either genu valgus, it can be genu varus, or it can be even windswept deformity, right? So all of these features of rickets or osteomalacia would be seen. That is important. Moving further, if I talk about the recommended dietary allowance of vitamin D in children, it is usually 400 international units per day, that is 10 milligrams per day, and in adults it is almost half, that is 200 international units or 5 milligrams per day. Okay, in pregnancy it again becomes 400 international units. Then if I talk about toxicity of vitamin D, please remember, as we know, vitamin D is known to increase serum calcium and phosphate levels. Therefore, in vitamin D toxicity, which would usually occur if vitamin D is taken in excess more than 50 milligrams per day or more than 5,000 international unit. So here usually there can be excess of calcium, and this excess of calcium can deposit even in the normal tissues, and this condition would be known as metastatic calcification. This metastatic calcification would lead to deposition of calcium crystals even in the soft tissues and the blood vessels. This would lead to calcinosis, and if there is calcinosis of the blood vessel wall, then the patient can suffer from hypertension, right? Then now if I talk about the sources of vitamin D, as we know, vitamin D is usually obtained from either fishes or it can be obtained from the sunlight due to exposure to UVB rays. So the richest source, if they ask you, the answer would remain same as vitamin A, that is halibut fish liver oil. So halibut fish liver oil is the important or the richest source for vitamin A as well as vitamin D. Whereas if they ask you which is the plant source of vitamin D, then your answer should be there is no plant source for vitamin D. Okay, there are two vitamins which does not have any plant source. One is vitamin D, the other one is vitamin B12. So these two vitamins do not have any plant source, and therefore if the question is which vitamins are deficient in strict vegetarians or vegan population, then your answer should be vitamin D or vitamin B12. If you need to choose one answer amongst them, then your answer should be vitamin B12. Why? So please remember, vitamin D can also be synthesized with the help of sunlight, but vitamin B12 does not have any other source apart from the animals. Okay, so vitamin B12 is the most deficient vitamin in strict vegetarian or vegan population. Please remember this. Moving further, if I talk about infancy, so as we know, vitamin D is usually deficient in milk, and therefore in India we give vitamin D supplementation to children, right? Vitamin D supplementation is given to children in India, and the dose is 400 international unit. Okay, and it is given up till 1 year of age. This is important. Moving further, if I talk about the next fat soluble vitamin, that is vitamin E. So vitamin E is actually isomer of tocopherols. Okay, so please remember, it is an isomer of tocopherol, and the most active form of vitamin E is called as alpha tocopherol. The most active form of vitamin E is known as alpha tocopherol. Now if I talk about the functions of vitamin E, please remember, usually vitamin E has a very important function, that it is the most potent antioxidant vitamin inside our body. So please remember, if they ask you which is the most potent antioxidant vitamin, the answer should be vitamin E. Whereas the other antioxidant vitamins are A's, that is vitamin E, vitamin A, vitamin C and vitamin E, but the most potent would still remain vitamin E. It is also a lipid-phase antioxidant. That means it prevents oxidation of polyunsaturated fatty acids, as well as it also prevents oxidation of LDL, that is low density lipoproteins, right? Now if I talk about the deficiency of vitamin E, guys, so first of all, please remember, vitamin E can cause vitamin E deficiency can lead to axonal degeneration. If the axons, mainly in the posterior column, they are degenerated, okay, so if the axons of posterior column are degenerated in the spinal cord, then there would be decreased joint sensations and there would be decreased joint position sense and decreased vibration sense, okay, so both of these senses would decrease. Apart from that, the patient can also have some spinocerebellar symptoms like balance disturbances or ataxia. Even the patient can suffer from ophthalmoplegia, and that can manifest as ptosis usually, right, drooping of eyelids. Apart from this, the patient can even have peripheral neuropathy, right, the patient can even suffer from peripheral neuropathy. There can be skeletal myopathy even in this patients. Skeletal myopathy can also be seen. And a very important finding, as we know that vitamin E is an antioxidant, therefore it also acts as an antioxidant in the erythrocytes or the RBCs, where it destroys the free radicals. But if vitamin E is deficient, what will happen, that the free radicals inside the RBCs will increase, and that can cause hemolysis, and that can land up the patient in hemolytic anemia. So vitamin E deficiency can also cause hemolytic anemia in the patient. Please remember this, right? If I talk further about the toxicity now, please remember, toxicity of vitamin E is like, please remember, if they ask you the least toxic fat soluble vitamin, then your answer should be vitamin E. So please remember, vitamin E is the least toxic fat soluble vitamin, okay, and usually if there is toxicity of vitamin E, there would be decreased platelet aggregation. This is not important to remember, you can just skip it. If I talk about the sources of vitamin E, this is important. Please remember, vitamin E can be obtained from wheat germ oil, okay, vitamin E is obtained from wheat germ oil, or it can also be obtained from cotton seed oil and even from sunflower oil. So wheat germ oil, cotton seed oil and sunflower oil are the sources of vitamin E. If I talk about the therapeutic applications or therapeutic uses of vitamin E, as we know, it is an antioxidant, or rather the most potent antioxidant. Definitely it is used for aging purposes, skin aging ke liye. Along with that, it can also be used for hair fall or alopecia in some conditions. It is used in cases of retrolental fibroplasia, whereas it is also used in a condition in neonates called as bronchopulmonary dysplasia or chronic lung disease, and even it has implications in intraventricular hemorrhages in the neonates, right? And sometimes it can also be used in cases of intermittent claudication. If I move further, talking about the next vitamin, that is vitamin K, again a fat soluble vitamin, and please remember, vitamin K is usually a naphthoquinone derivative. It is a naphthoquinone derivative. There are usually three forms of vitamin K. Vitamin K1 is also called as phyloquinone. Vitamin K1 is also called as phyloquinone, and phylo means plant, right? Phylo means plant. Therefore, vitamin K1 or phyloquinone is derived from plant sources. Whereas next is vitamin K2, which is also called as menaquinone. Okay, menaquinone, it is usually derived from the intestinal bacterial flora. As we already discussed that vitamin K can be synthesized in our body inside the intestine by the bacterial flora. So vitamin K2 or menaquinone can be synthesized by the intestinal bacterial flora. And the third form is vitamin K3, also called as menadione. And this menadione or vitamin K3 is a synthetic form of vitamin K. And please remember the most important statement, if they ask you which is the only water soluble form of vitamin K3, then your answer should be which is the most water soluble form of vitamin K, then your answer should be vitamin K3 or menadione is the only water soluble form of vitamin K, right? Then if I talk about the functions of vitamin K, As we know, guys, the most important and the preliminary function of vitamin K is causing gamma carboxylation of clotting factors, right? It is responsible for gamma carboxylation of clotting factors 2, 7, 9 and 10. Okay, this is how you need to remember. 2 plus 7 is equal to 9 and 10, right? So clotting factors 2, 7, 9 and 10, they need a gamma carboxylation where a carbon dioxide group is added at the gamma carbon, right, and it is mediated by vitamin K. Usually we know the carboxylation reactions which are mediated by carboxylases enzyme. These carboxylases enzyme usually use vitamin B7 or biotin as their coenzyme, but one of the places which is a biotin independent carboxylation is gamma carboxylation of clotting factors, where vitamin K is used as a coenzyme. Please remember this, right? Then if I move further, talking about deficiency of vitamin K. So please remember, if vitamin K is deficient usually, then there would be a prolonged bleeding in these patients. There would be bleeding episodes in these patients as the clotting factors would not be formed properly, right? Therefore there would be a prolonged bleeding time and a prolonged prothrombin time which would be seen in this patients, right? Please remember this. If I talk about at birth usually, so as we know, vitamin K is usually deficient in neonates. It is due to decreased or low body stores of vitamin K in neonates. Secondly, breast milk is also deficient in vitamin K. Third most important thing is the neonatal gut, that is the intestine of the neonate does not contain any bacteria, so it is a sterile gut, so vitamin K cannot be synthesized again, right? So and liver is also immature usually. So all of these factors contribute that vitamin K would usually be deficient in children. Therefore vitamin K is given to children in India at birth itself, right? And an injection of vitamin K is given. This can be given either via subcutaneous or an intramuscular route at birth. And please remember, the doses is important. So if there is a preterm neonate, the dose is usually 0.5 mg, whereas if it is a term neonate, the dose is 1 mg of vitamin K. And the reason has also been asked, why vitamin K is given at birth. So the answer to this question would be for prevention of hemorrhagic disease of newborn. If there is vitamin K deficiency in neonates, that can cause hemorrhagic disease of newborn. To prevent this, we generally give vitamin K injections at birth itself, 0.5 mg and 1 mg in preterm and term neonates respectively. Then if I talk about toxicity of vitamin K, usually it would lead to hemolysis. Toxicity of vitamin K can cause hemolysis that will increase the bilirubin levels, leading to hyperbilirubinemia, and that can manifest as jaundice in children, right? Please remember this. If I move further now, talking about the next vitamin, that is vitamin B1. So now starting with the water soluble vitamins and the B complex vitamins. So vitamin B1 is also known as thiamine. I hope all of you are quite aware. Vitamin B1 is also known as thiamine, and please remember, thiamine contains usually a pyrimidine ring in it. Okay, it contains a pyrimidine ring in it. Now if they ask you which is the source of vitamin B1, so please remember it is unpolished rice or wheat. Okay, so unpolished rice or wheat are the source of vitamin B1, that is thiamine. Because please remember, a layer on these cereals known as the allurone layer is the source of thiamine. So if this allurone layer is removed during polishing, then definitely the patients can have vitamin B1 deficiency. So please remember, in cases of polished rice eaters, if they ask you, polished rice eaters are at a risk of developing. Polished rice eaters, usually in southern parts of India, they are at a risk of developing thiamine deficiency because the allurone layer would be absent in these cereals, right? Please remember. Then if I ask you which is the active form of thiamine, so please remember the active form of thiamine is known as thiamine pyrophosphate, and sometimes it is also referred to as thiamine diphosphate. The most active or most potent would be thiamine pyrophosphate, right? So please remember, thiamine pyrophosphate is used as a coenzyme. We already saw that water soluble vitamins are used as coenzymes at multiple places. So thiamine pyrophosphate is also used as coenzymes in reactions like the link reaction by the pyruvate dehydrogenase enzyme, in TCA cycle by alpha ketoglutarate dehydrogenase enzyme, also by the branch chain keto acid dehydrogenase enzyme, and even by the most important, you need to remember the trans ketolase enzyme. All of these enzymes use thiamine pyrophosphate or vitamin B1 as their coenzyme. If I talk about deficiency of vitamin B1, usually it would lead to beriberi, right? Beriberi can be of two types. Either it can be wet beriberi or it can be dry beriberi. If they say there is wet beriberi in a patient, that means there would be cardiovascular manifestations present in a patient. The patient can suffer from a high output cardiac failure. And due to this heart failure, the patient can have usually edema in the lower limbs. Here you can see there is a pitting type of edema which is seen. If they say there is a dry beriberi, that means there is involvement of the central as well as the peripheral nervous system, and the patient would have a symmetric motor and sensory neuropathy. So both the domains would be involved. There would be symmetric motor and sensory neuropathy in this patients of thiamine deficiency. Please remember this, right? If I move further, talking about next syndrome which can be associated with thiamine deficiency. So if there is a chronic alcoholic patient, so chronic alcoholics are usually at a risk of developing thiamine deficiency, and in these patients there is a risk of developing Wernicke-Korsakoff syndrome. So Wernicke-Korsakoff syndrome is actually a combination of Wernicke's encephalopathy, right? It is a combination of Wernicke's encephalopathy and Korsakoff psychosis. So these two findings or these two syndromes are combined together. In Wernicke's encephalopathy, usually there is a triad known as GOA, where G goes for global confusion, O goes for ophthalmoplegia, and A goes for ataxia. Truncal ataxia is usually seen. Along with that, a horizontal nystagmus can also be noted in these patients. Whereas if I talk about Korsakoff syndrome, please remember in Korsakoff syndrome usually, or Korsakoff psychosis, the patient would have dementia, that is memory loss. And as he has memory loss, to fill up the memory gaps, usually the patient tries to make up false stories. And when the patient tries to make up false stories to fill up the memory gaps, this phenomena is known as confabulations. And confabulation is very important. It is a feature of Korsakoff psychosis. From psychiatry, it is important. Then if I move further, talking about the assessment. But before that, please remember, if a chronic alcoholic patient presents to you with features of Wernicke-Korsakoff syndrome or delirium tremens, usually the first treatment that you will give to him is usually IV thiamine followed by IV glucose. Right? Please remember, thiamine should be given first followed by glucose, because if thiamine is not given, glucose cannot be used properly. Right? Then if I talk about assessment, so please remember, thiamine levels can be assessed with the help of RBC or erythrocyte transketolase activity. We'll check for the RBC transketolase activity. Along with that, we can also check for the urinary thiamine levels, right? Then if I talk about the next one, that is vitamin B2. So vitamin B2 is also called as riboflavin, and riboflavin is a light sensitive vitamin. So it is usually destroyed during phototherapy. So if a patient is undergoing phototherapy, you need to supplement riboflavin to that particular patient. And it is also called as a pigmented vitamin. Why it is known as a pigmented vitamin? Because it would generally impart a yellow color to the urine. Then now, if I talk about the active forms of vitamin B2 or riboflavin, the forms would be FMN, that is flavine mononucleotide, and the other one would be flavine adenine dinucleotide. Right? Both of these would be used as coenzymes. So please remember, flavine mononucleotide is usually used as a coenzyme in ATC complex 1, whereas in cases of L-amino acid oxidase, right? Whereas FAD is used as a coenzyme in ATC complex 2 with the help of succinate dehydrogenase, and also it is used in cases of D-amino acid oxidase, whereas it can also be used in cases with acetyl coenzyme A dehydrogenase. Okay, so please remember, FAD can be used at these three places: ATC complex 2, D-amino acid oxidase, and acetyl coenzyme A dehydrogenase. Sometimes also with xanthine oxidase, FAD acts as a coenzyme for xanthine oxidase. Right? If I talk about deficiency of vitamin B2 or riboflavin, this condition is known as ariboflavinosis. And in cases of ariboflavinosis, initially the patient would be asymptomatic, but gradually the patient will develop symptoms, and the first would be usually chelosis, that is inflammation of your lips. So here in this image you can see there is usually desquamation, or there is fissuring of the lips that you can see in this condition, right? So this condition is known as chelosis. Along with that, then the patient can develop inflammation of the tongue also. This condition is known as glossitis. So please remember, glossitis is inflammation of tongue, and in some cases it can also lead to a condition known as geographic tongue. So please remember, similar image came in December 2021 session, but vitamin B2 was not an option. So please remember, it can be seen in vitamin B2 as well as vitamin B12 deficiencies. More commonly it is seen in vitamin B2 or riboflavin deficiency. So it is not an option. You can mark vitamin B12 as well. Usually in vitamin B12 deficiency there is a fissured tongue which is seen. Okay, there would be a fissuring of tongue which is usually seen. Then the next finding is important, that is angular stomatitis. There would be, please remember, there would be inflammation of the angles or the corners of the mouth, and this condition is known as angular stomatitis when there is maceration of the angles. And please remember, this is the most pathognomic feature. If they ask you which is the most pathognomic feature of vitamin B2 deficiency, answer should be angular stomatitis. Okay, please remember this. These are the most important thing. Apart from that, there can also be some eye manifestations. There can be keratitis in this patient, there can be conjunctivitis, lacrimation, photophobia even, and some cases can also describe seborrheic dermatitis in this patient. There is a high risk of seborrheic dermatitis as well, right? So please remember all of these. Then if I talk about the assessment of vitamin B2 usually, so it can be assessed with the help of RBC glutathione reductase activity. Okay, it can be assessed with the help of RBC or erythrocyte glutathione reductase activity. We will check for these RBC glutathione reductase activity, and we can even check for vitamin B2 levels in the urine, right? So this would help. Moving further, talking about the most common vitamin all of us are quite aware of, that is vitamin B3, also called as niacin, also called as nicotinic acid. So niacin or nicotinic acid is vitamin B3, and as we know, it is usually a endogenously synthesized vitamin which can be synthesized in our body, and it is synthesized from an amino acid called as tryptophan. So please remember, 60 milligrams of tryptophan would lead to synthesis of 1 milligram of niacin. Okay, it occurs usually in multiple steps, but the most important step, or the rate limiting enzyme you can say, is mediated by an enzyme which is known as kynureninase. Okay, this kynureninase enzyme would require vitamin B6 or pyridoxine as its coenzyme. So this kynureninase enzyme of tryptophan metabolism will use vitamin B6 as its coenzyme. So I'll explain to you what it for what I have given this. Okay, then if I talk about the active form of niacin or vitamin B3, it is usually NAD, that is nicotinic acid dinucleotide, NAD plus, and the other one is NADP, that is nicotinic acid dinucleotide phosphate. So both of these also will act as coenzymes. So please remember, usually NAD plus acts as coenzymes for almost all dehydrogenase. Okay, it will act as coenzyme for almost all dehydrogenase except for those which for which the FAD was acting as a coenzyme, right? And NADP, please remember, NADP acts as a coenzyme for most important enzymes. The important enzymes of hexose monophosphate shunt pathway, that is G6PD, glucose 6-phosphate dehydrogenase, and 6-phosphogluconate dehydrogenase. For these enzymes, usually NADP is used as a coenzyme. Apart from that, for cytoplasmic isocitrate dehydrogenase also, and even for malic enzyme pathway, NADP plus is used as a coenzyme. After hexose monophosphate shunt, I hope all of you are quite aware, it is different, that NADPH is formed. That NADPH is usually used for reductive biosynthesis, that is used for reductive biosynthesis of fatty acid and cholesterol, right? That is a different thing. NADPH is different, which is a byproduct of HMP shunt or HMP pathway. Then if I talk about deficiency of vitamin B3, all of us are quite aware, this condition is known as pellagra. Usually the patient initially will complain of some non-specific or vague symptoms, then generally the patient will progress to pellagra, right? The initial manifestation would be a photosensitive dermatitis. Photosensitive, by that I mean usually when the patient would be exposed to sunlight, then these dermatitis manifestations would develop. Okay, there would be involvement of the hands mostly. Okay, there would be involvement of the trunk or the back, and most important, the neck would also be involved, and this condition is called as Cazal's necklace, right? This condition is known as Cazal's necklace. Then apart from that, the patient can also develop diarrhea. There can also be dementia in this patient, right? Even the patient can have depression, or there can be depressive psychosis in this patient. The patient can have an acute onset delirium, and lastly the patient can finally land up in death. So this is also considered as a 6D disease, right? So these are the 6 Ds of pellagra. Then if I talk about toxicity, right? Then if I talk about toxicity of vitamin B3 or niacin, it will usually lead to cutaneous flushing. Apart from that, it can also cause gastric irritation, and there would be impaired glucose intolerance which can be seen along with this. But if they ask you the most fatal complication of niacin toxicity, then your answer should be autoimmune hepatitis. Fulminant hepatitis. The answer should be fulminant hepatitis, right? It should be fulminant hepatitis. Then if I talk about the therapeutic application or uses of niacin, as we all are quite aware that niacin is usually used as an anti-dyslipidemic drug, right? And the most important thing that you need to remember, when we use it as an anti-dyslipidemic agent, so please remember it is the agent which increases HDL cholesterol. So please remember, maximum HDL cholesterol increasing property is seen with which drug? So it is niacin. Okay, and it will decrease triglyceride and LDL levels. Okay, please remember this. Moving further, talking about vitamin B5, which is also called as pantothenic acid. Vitamin B5 or pantothenic acid, please remember, it has majorly a coenzyme role. And it is rather a component of coenzyme A. So vitamin B5 is found in coenzyme A, and as we know, coenzyme A is used up in many cycles. Therefore, it is used in TCA cycle like acetyl coenzyme A or succinyl coenzyme A, or even in cases of cholesterol synthesis, HMG coenzyme A. So in all these cycles, usually or pathways, pantothenic acid would be used. If there is deficiency of pantothenic acid or vitamin B5, the patient would suffer from something called as nutritional melalgia. The person can suffer from something called as nutritional melalgia. So melalgia means limb pain, and as it is due to nutritional deficiency of vitamin B5, it is called as nutritional melalgia. There is a burning sensation in the foot of this patient, therefore it is also known as burning foot syndrome, sometimes also referred to as Gopalan's burning foot syndrome. So burning foot syndrome or nutritional melalgia are features of vitamin B5 or pantothenic acid deficiency. Next, if I talk about vitamin B7, vitamin B7 is also known as biotin, right? So please remember, vitamin B7 or biotin, the most active or the most potent form of vitamin B7 is known as carboxybiocitin. The most active form is known as carboxybiocitin. Okay, and as we are all quite aware that biotin is the major coenzyme used for all carboxylases. Okay, all of the carboxylases in the carboxylation reaction will use a biotin as their coenzyme, except some of them that I'll discuss. Okay, so please remember, major carboxylases like pyruvate carboxylase, acetyl coenzyme A carboxylase, or propionyl coenzyme A carboxylase, all of them will use biotin as their coenzyme. Important carboxylases generally use A, B, C. That means A, they require ATP, B, they require vitamin B7, that is biotin, and C, as they are going to add carbon dioxide group, they are going to add carbon, therefore they will require a carbon dioxide group, right? Please remember. Then there are some reactions which are considered as B7 independent carboxylation reactions. One of them we have already seen in a vitamin, that was vitamin K, right? So vitamin K dependent gamma carboxylation, vitamin K dependent gamma carboxylation of clotting factors 2, 7, 9 and 10, there biotin is not required. The second example would be malic enzyme. In cases of malic enzymes also, we do not require B7 for carboxylation. The third important is CPS1 and CPS2, that is carbamoyl phosphate synthetase 1 and carbamoyl phosphate synthetase 2. So CPS1 and CPS2 would not require vitamin B7 for carboxylation. So these are the three vitamin B7 independent carboxylation reactions, vitamin K dependent gamma carboxylation of clotting factors, Malick enzyme pathway, and CPS1 and 2. If there is deficiency of vitamin B7, usually that can cause multiple symptoms. There can be some mental symptoms, like there would be confusion or depression in the patient. The patient can even suffer from seborrheic dermatitis, or the patient patient can even have seborrheic or exfoliated dermatitis in these cases. And there's an important condition, there is usually desquamation of skin. This is called as erythroderma desquamativum. Okay, this is called as a erythroderma desquamativum. The patient will get a erythrodermic or a red rash all over the skin. Next, talking about a very important vitamin, that is vitamin B6, also called as pyridoxine. Okay, if I talk about the most important vitamin, that is vitamin B6 or pyridoxine, it is important from biochemistry point of view because it has multiple applications. So vitamin B6 or pyridoxine, right? It contains a pyridoxine ring. The active form of vitamin B6 is known as pyridoxal phosphate. The active form is known as PLP or pyridoxal phosphate. It has coenzyme role in multiple reactions. So please remember, pyridoxine acts as a coenzyme first of all in the most important, that is transamination reactions. That is the enzymes alanine and aspartate transaminases. The liver enzymes will use pyridoxal phosphate as their coenzyme. Then in cases of amino acid decarboxylation, when histidine is converted to histamine, 5-hydroxytryptophan is converted to 5-hydroxytryptamine, that is serotonin, okay, or when glutamate is converted to gamma aminobutyric acid, that is GABA. So in all these amino acid decarboxylation reaction also we will require pyridoxine as a coenzyme. Even when there is a transfer of sulfhydryl group from one amino acid to other, that is in transsulfuration reaction, we will require pyridoxine. Even in cases of tryptophan metabolism, this we know quite now. So in cases of tryptophan metabolism, please remember, usually we will require vitamin B6 when there is production of vitamin B3. So when vitamin B3 or niacin synthesis occurs from tryptophan, in this condition the kynureninase enzyme will use vitamin B6 as a coenzyme. Important features that I need to tell you about pellagra is, first of all, usually as we know, vitamin B3 deficiency can be seen due to nutritional causes. It can be seen if vitamin B6 is deficient, right? Apart from that, if a patient is having a staple diet of maize or corn, usually please remember, maize is usually deficient in tryptophan. Maize is deficient in tryptophan, therefore the maize eating or corn eating population would be at a risk of developing pellagra because it does not contain tryptophan. Along with that, the cereal known as jawar, that is sorghum, usually it contains leucine. Okay, it contains leucine, and leucine is known to inhibit the niacin synthesis pathway. Okay, so therefore leucine is known to cause vitamin B3 deficiency, that is pellagra. So if they ask you which is the pellagrogenic amino acid, answer should be leucine. Pellagrogenic or pellagra causing amino acid is leucine. Please remember this, okay, which is usually present in jawar. Then if I move further, talking about vitamin B6 again, it is also used by the allosynthetase enzyme of heme synthesis. So please remember, vitamin B6 is also used in heme synthesis. Therefore, when there would be deficiency of vitamin B6, heme synthesis would be inhibited, and that can lead to a microcytic hypochromic anemia that you can see on the peripheral smear over here. So a microcytic hypochromic anemia can be noticed in a patient of pyridoxine deficiency. Apart from that, the rate limiting enzyme of glycogenolysis, that is glycogen phosphorylase, also uses vitamin B6 as a coenzyme. Please remember. Moving further, if I talk about deficiency of vitamin B6, it would usually lead to the most important symptom of vitamin B6 deficiency is peripheral neuropathy. There would be burning or tingling sensation in the extremities of the patient. Peripheral neuropathy is the commonest manifestation. Apart from that, the patient definitely can have some mental symptoms like confusion, or there can be depression. Okay. Apart from that, a very important and a characteristic finding would be convulsions. The case can also mention that the patient was having seizures or convulsions, right, along with the microcytic hypochromic anemia on the peripheral smear. If I talk about assessment of vitamin B6, so please remember, we can usually perform a RBC or erythrocyte transaminase levels. We can all check for the RBC or erythrocyte transaminase activity, that can definitely define the pyridoxine. That can definitely define about the pyridoxine levels. Apart from that, we can perform a tryptophan loading test. Apart from that, we can also even check for the pyridoxal phosphate levels in the blood. As well as when there is vitamin B6 deficiency, usually there is increased excretion of homocysteine in the urine. Apart from that, there is also excretion of xanthurenic acid. Xanthurenic acid is also excreted as vitamin B3 is not formed, and oxalate crystals are also excreted in the urine. So oxaluria is also a feature of pyridoxine deficiency, right? Then if I talk about toxicity, usually toxicity would generally only cause sensory neuropathy in this patient. Sensory neuropathy would be seen. Moving further, talking about the hematopoietic vitamins now, that is vitamin B9 and vitamin B12. Vitamin B9 is also called as folic acid or folate, right? And vitamin B9, please remember, or folic acid, it is responsible for DNA synthesis. I hope all of you are quite aware that folic acid is responsible for DNA synthesis. The active form of folate is known as tetrahydrofolic acid. Whereas in deficiencies of vitamin B9 or folic acid, all of us are quite aware, the most important feature would be megaloblastic anemia. As DNA synthesis is inhibited, therefore there would be megaloblastic anemia in the patient. If I talk about megaloblastic anemia, it would also be seen in cases of vitamin B12 deficiency, where on a peripheral blood smear there would be hyper segmented neutrophils. That means more than 5 lobe nucleus hoga neutrophils ka. These are known as hyper segmented neutrophils. Along with that, there would be macroovalocytes which would be seen. There would be anisopoikilocytosis. Anisopoikilocytosis is sometimes seen, and most important is teardrop cells are also seen. Okay, teardrop cells can also be seen. So these are the features of megaloblastic anemia. Apart from that, if I talk about vitamin B9 deficiency, please remember, usually it can also lead to neural tube defects. If there is folic acid deficiency in pregnancy, that can cause neural tube defects in the fetus, and that can manifest as either spina bifida or anencephaly in the patient, right, or in the fetus. So please remember this. Then if I talk about the levels of vitamin B9 or folic acid, that can be assessed with the help of, so please remember, usually we can check for serum folic acid levels which would be low. Then the homocysteine levels would generally be high in this condition. We can also perform a histidine load test. Histidine load test can also be performed. Along with that, we can also perform a FIGLU test. It is a urine test. FIGLU test can also be performed. This is important, right? Moving further, if I talk about the next one, that is vitamin B12 now. Vitamin B12 may usually, it is known as cobalamin. The first thing is, it is known as cobalamin. Now it contains 4 pylor rings which are actually joined or actually joined to the cobalt. So therefore it is known as cobalamin. So if I talk about the role of vitamin B12, as we know, vitamin B12 also acts as a coenzyme in multiple enzymes or multiple reactions. First of all, as methyl B12, it will act as a coenzyme in methionine synthase. Okay, so methionine synthase enzyme will use vitamin B12 as the coenzyme. Along with that, it also acts as a coenzyme in methylmalonine coenzyme A mutase. In this reaction also, it acts as a coenzyme. Okay, so please remember this. If I talk about absorption of vitamin B12, I hope all of us are quite aware that vitamin B12, it usually forms a complex with intrinsic factor of Castle. So this intrinsic factor of Castle is produced by the parietal cells in the stomach. So please remember, it forms the complex with vitamin B12, intrinsic factor of Castle, and this complex is generally absorbed from the terminal ileum. Whereas folic acid, please remember, it is absorbed from the jejunum. Folic acid is absorbed from the jejunum. This is important. Whereas iron is absorbed from the duodenum. So if there is any pathology that would affect the ileum, that means there is ileal resection, or maybe there is ileocecal tuberculosis, okay, or there is a malabsorption syndrome, maybe there is inflammatory bowel disease like Crohn's disease. In this condition, there would be malabsorption of vitamin B12. Or in conditions where there is the intrinsic factor of Castle would not be produced properly. That means when there is a parietal cell damage, the intrinsic factor of Castle is not produced. So in this condition also there would be vitamin B12 deficiency, and this condition is actually known as pernicious anemia. This condition is known as pernicious anemia. So usually in cases of autoimmune gastritis, there is damage of the parietal cells due to antibodies that will lead to decreased levels of intrinsic factor of Castle. Therefore there will be vitamin B12 malabsorption, and that would cause pernicious anemia. Yes, megaloblastic anemia would also be seen along with vitamin B12 deficiency, because vitamin B12 is also required for DNA synthesis. So if DNA synthesis is inhibited, again megaloblastic anemia can be seen in this condition. Along with that, homocystinemia, there would be increased levels of homocysteine in folic acid deficiency as well as in vitamin B12 deficiency. Okay, so there would be homocystinemia as well as homocysteine urea. Along with that, there's a very important condition known as SAT. Okay, on long-term vitamin B12 deficiency, usually in vegans vagara, there can be a subacute combined degeneration of spinal cord. Subacute combined degeneration of spinal cord, where there is actually demyelination. Okay, demyelination of the spinocortical tract as well as the demyelination of the pyramidal tract as well as demyelination of the posterior column of the spinal cord. So therefore it can lead to demyelinating neuropathy. This is called as subacute combined degeneration of spinal cord. Okay, this is important as well. Apart from that, if we talk about assessment, how we will assess the levels, so please remember, usually we can check for cobalamin levels in the serum as well. Okay, we can check for serum cobalamin levels. They would be low definitely. Homocysteine levels, as I told you, they would be elevated. Folic acid level, as vitamin B12 also plays a role in folic acid synthesis, therefore folic acid would also be low. Methyl malonyl, this is important guys, this has been asked. So methyl malonyl coenzyme A mutase, methyl malonyl coenzyme was metabolized, but if vitamin B12 is deficient, therefore there would be increased levels of methyl malonic acid. Okay, there would be methyl malonic aciduria. Apart from that, for actually assessing the malabsorption of vitamin B12, we can perform a test known as Schilling's test, which is not performed nowadays, but it can be performed. Schilling's test. Okay, please remember. I want to tell you one more important point about vitamin B12. Usually vitamin B12 or hydroxycobalamin is the drug of choice in cases of which poisoning? So please remember, it is the drug of choice in cases of cyanide poisoning. It is the drug of choice in cases of cyanide poisoning. This is also important that you need to remember, right? Now moving to our last vitamin, and that is vitamin C. If I talk about vitamin C guys, now please remember, vitamin C is also called as ascorbic acid, right? It is also known as ascorbic acid. The source of vitamin C, usually it is obtained from citrus fruit, as all of us know, like orange, lemons, vagara. But the richest source of vitamin C, please remember, it is Indian gooseberry. Okay, most of us get confused over here. It is Indian gooseberry, that is amla, what we call in simple terms, right? So amla or Indian gooseberry is the richest source of vitamin C. If I talk about the role of vitamin C, so please remember, vitamin C is also water soluble vitamin, therefore it also acts as coenzyme, and it acts as a coenzyme in hydroxylases. Okay, in hydroxylation reactions. So in hydroxylases, vitamin C acts as a coenzyme. Along with that, it also acts as a coenzyme with proline and lysine hydroxylase. It also acts as a coenzyme for proline and lysine hydroxylase, and as all of us are quite aware, proline and lysine hydroxylase are usually the enzymes which are used in collagen synthesis. So please remember, if these enzymes are not working, the collagen synthesis would be defective, and if there is defective collagen formation, then that can lead to recurrent bleeding manifestations in the patient. Okay, so there would be gum bleeding in this patient. As we know, in deficiency of vitamin C, which is known as scurvy, there is what? There would be gum bleeding. This is most important. There would be gum bleeding. Apart from that, there would be small bleeding spots all over the skin. These are called as petechiae. Sometimes they can even extend and lead to purpura or ecchymosis, right? And there would sometimes be knee joint swelling. Okay, and these knee joint swelling is actually due to hemarthrosis. There would be bleeding in the joints. Okay, there would be painful red tender joints which would be seen, right? Apart from that, there is also pseudo paralysis of the muscle. So please remember, there is pseudo paralysis due to the defective collagen. There would be pseudo paralysis of the calf muscles mainly. Pseudo paralysis of the calf muscles is usually seen in scurvy. Apart from that, there is an important finding, that is scorbutic rosary. Again, here also we will find beading of the costochondral junctions, but how it is different from brachytic rosary. In rickets it was rounded and non-tender. Here it would be sharp, angulated and tender. That is painful rosary would be seen in this condition, right? Please remember. Then if I talk about infantile scurvy, usually infantile scurvy means, as we know, cow milk is usually deficient in vitamin C, right? Cow milk contains decreased levels of vitamin C. Therefore, when a child is shifting from breast milk to cow milk, that is from 6 to 12 months of age, when it is a weaning period, when complementary feeds are being given to a child, the child can suffer from vitamin C deficiency. Therefore, it is known as infantile scurvy, also sometimes referred to as Barlow's disease, right? Therefore, in this condition, during weaning time, we prefer giving vitamin C supplementation to the child. Important is, like, who studied on this. Okay, from PSM point of view it is important. So James Lind was a scientist who studied on scurvy. Okay, he found out that citrus fruits can be given for the treatment of scurvy. James Lind was a scientist. Okay, he studied it on sailors usually. So these are the important findings that you need to remember for all the vitamins. Thank you so much. With this I end and wind up the session for today, and I know it was a long session, but vitamins are important, so just invest some time. At least remember the most important highlighted points. Okay, if you cannot remember all of that, at least remember the application part at least, okay, and the clinical case part. Thank you so much. With this I end the session. Meet you in the next session. Till then, goodbye and good luck. Prepare really well.